Hi, everyone. So first, I just want to thank the O'Brien Institute of Public Health and, of course, Rebecca for that really great introduction. I'm really feeling pumped up right now. Like Rebecca mentioned, I'm the strategic advisor for Canadian Students for Sensible Drug Policy. So this is a national kind of grassroots nonprofit that is run by youth for youth, particularly young people kind of really interested in the drug policy space. Today, what I'm going to talk about is kind of giving an overview on youth and some of the concerns around cannabis legalization, which we've heard a lot about today. But specifically, I'm going to focus on the CSSDP Youth Roundtable that we organized during the task force consultation. I'm going to review some specific pieces of the Cannabis Act as it relates to young people. Again, I'm going to consider some of the research that's been done on youth and cannabis, but I won't go too much into that since we've heard that kind of again and again, and stress really the importance here of thinking about the ways that we're going to operationalize research where we really want to kind of prioritize a wider lens on how we're thinking about harms and considers how various policy options could really play out here and the effect that could have on young people. And then I'm going to couple that with kind of the importance of education, prevention, and intervention tools for young people, rather than only focusing on tighter restrictions in and of themselves. So we've seen this before, but we know that young people in Canada have some of the highest cannabis using rates in the world, particularly young people who are 18 to 24. So, how we talk about young people, and what I kind of want to preface my presentation today, is that young people are a really diverse group of young people across Canada. So the idea that the needs of specific communities and populations really do need to be considered, and young people have really different experiences when it comes to cannabis. So I wanted to just kind of quickly throw up that graph there. The point was actually made earlier by Dr. Wild, but simply that the dark blue line represents young people 15 to 24, and the light blue line represents those who are 25 plus. So just kind of making this point here that research shows that youth just seems to kind of drop off after the age of 25, or that adults are kind of growing out of cannabis use, whether that is because of life responsibilities, careers, kind of other life course markers. Young people also tend to view cannabis as less harmful than other illegal substances. And another thing that we want to really keep in mind, or kind of keep at the forefront of our discussions on the different policy options that we have ahead of us, is that young people right now, so youth and young adults, are actually disproportionate targets of drug-related enforcement, particularly minority youth. So the highest drug-related arrests in 2013 were for young adults who are 18 to 25. And when we break down what those drug-related arrests were for, over 80% are cannabis-related. So given that young people are some of kind of the biggest consumers of cannabis in Canada, and that one of the main objectives of the Liberal Party here was really focused on protecting youth, right? We've heard that over and over again. CSSDP really wanted to create some kind of platform for youth voices. We really felt they weren't being prioritized in this discussion despite being very central to the mandate. So we reached out to the Secretariat for the Legalization and Regulation of Cannabis, as well as the task force, and they actually worked with us to organize a youth-focused meeting. We also worked with the International Center for Science and Drug Policy and LIFT, where we organized this workshop that brought together youth and young adults between the ages of 17 to 29 who were kind of interested in this idea of legalization and what it could mean for them. So we had about 25 participants that day. Again, a really small slice of the diversity that exists in young people. But we did have young people there. Some of them were post-secondary students, some were graduate students, some just worked full-time or part-time. Some were identified as cannabis users and others were non-cannabis users. Some used cannabis medically. Some were working with at-risk homeless youth or other at-risk populations. Some also worked in the cannabis space. So we had some people that actually had worked or were working in illegal cannabis dispensaries or had worked with licensed producers. We also had a task force member there, so you can see Dr. Catherine Zane kind of in the top right corner there. We had a few local MPs kind of pop in, and a member of the federal secretariat with us that day as well. So we translated the discussion that we had in the day into an outcome document that really made kind of 10 overarching recommendations based on the 4 topics on the slide. We also had the opportunity to present this at the official youth stakeholder meeting that was also held in Toronto. So there were a variety of stakeholders at this official kind of task force meeting, but again, it's really important to stress that it was mostly people who worked with youth and very few kind of youth themselves. So again, what was really interesting in both our CSSDP roundtable and the official youth stakeholder meeting was that the potential of youth and young adults to be even more criminalized under a regulated system really anchored the discussion of the day. Almost every point was tying back to this idea of potential for criminalization. So it was really our hope that the task force was going to think about this, particularly through things such as high age restrictions, but also how are we going to deal with young people who possess and sell outside of the regulated system. So really the point here being, was that we really didn't want to see young people worse off under legalization than they had been under prohibition. So overall, we were quite pleased with the task force report. We thought the tabled legislation titled the Cannabis Act, has some things that need to be improved, but definitely was a good starting point. So to highlight some key pieces as it relates to youth, we know that it's not going to be a criminal offense for a young person, which in this section of the Act is defined as only 12 to 17, to possess up to 5 grams. It also won't be an offense for them to distribute, which refers to sharing but not selling up to 5 grams. And all youth up to the age of 17 will be dealt with under the Youth Criminal Justice Act for all other offenses. There were so many other pieces here that we could talk about. There's a lot of regulation around, for example, youth and advertising restrictions. There's also a 14-year maximum penalty tied to selling to minors. I mean, that's another thing that probably deserves its own kind of presentation as well. But really what the focus has been on and what we've been hearing kind of the most about is really on age restrictions under the Cannabis Act. So the tabled legislation sets the minimum age of access at 18, with room for provinces to adjust that on what they called individual realities. So this is going to lead to varying ages across Canada, so across our provinces and territories, ranging from 18 all the way up to 25, but also important to note there's no cap on how high that age could be. So CSSDP here in our report, we had recommended that the age of access be no higher than the age of access for alcohol. I also wanted to include just kind of a quick screenshot of a Global Peace News with some comments there from the Calgary mayor, and I thought it was a really good representation on how a particular body of research is really being used. We talked about it a lot this morning. I think Dr. Hill really addressed it, really hit the nail on the head, but really how this work is being used to prop up higher age restrictions. So he said that he was convinced by the research on youth and brain development, and because of this was going to push for higher age restrictions. So I thought we could talk a little bit more about this. And kind of think about the literature a little more as it pertains to youth and cannabis, and again, tie it back to our feedback from the roundtable. So following the task force line of thought, we know that age restrictions aren't about when it's safe to start using a substance, right? 18 isn't a safe age to start smoking tobacco or to start drinking alcohol, but rather, age restrictions really represent when we think that young people are old enough to start making these decisions. And 18 kind of seems to be the social marker of adulthood. So again, I make the comparison to alcohol and tobacco, but also we could go more broad than that, right? We could talk about voting, we could talk about gun ownership, we could talk about joining the Canadian Forces. So here I really think that our lens around harms really needs to include how ideas around criminalization and how we're going to balance public health and public safety. So we also need to consider that things like restrictions and potential criminalization have often been shown to be more harmful than use itself. So we have the potential here to even perhaps foster an illicit market that serves those who are going to be excluded by regulation. So here we have to employ both good judgment and available research around the likelihood of achieving the goals of both protecting young people and also the simultaneous goal of undercutting the black market. So if we think that our cannabis users, we know that the highest cannabis users are 18 to 25, we need to ask a lot of really important questions here, a lot of tough questions here, because sometimes we get a little bit uncomfortable when we're talking about young people and cannabis. Restrictions are not going to stop young people from accessing cannabis, and if our goal is to protect young people, then is it better to give young adults access to tested and regulated cannabis that's properly labeled and grown with strict production standards, rather than leaving them to source unregulated product from the illicit market? So I'm not going to go too much into this, but what really colors this discussion around age restriction is the research on age and how cannabis use could affect their ongoing brain development. So I'm never the one to say cannabis use is benign. I don't think that that's the right approach, but rather that research is still developing, which is something to consider before basing kind of higher age restrictions on this work alone. So again, to make the point, this work has yet to establish a causal link between cannabis use and various outcomes like brain development and functioning. So we're seeing a link, maybe an association, and it's unclear if cannabis is causing these outcomes or if it's part of a variety of risk factors. So a fair question we might ask here is, are these outcomes or these disadvantages a reflection of pre-existing differences that lead to increased substance use and risk-taking behaviors? It's also important that a lot of these studies are actually focusing on daily and chronic cannabis users, so it's misleading to kind of equate that to young people using cannabis once or even occasionally, is going to necessarily lead to these outcomes. And also, we never ever talk about how various social determinants of health complicate our understanding of this link. So why don't we talk about how do things like socioeconomic status, social support networks, healthy child development, coping skills, and more are contributing to these various outcomes. So we know that lower socioeconomic status, for example, is linked to worse outcomes when it comes to cognitive brain development. It's also linked to worse outcomes when we think about educational attainment and health more generally in young people. So this absolutely requires kind of a more open conversation around the strengths of this work as it relates to youth cannabis use. And again, the link with mental health is a really big one. So we have this association with various mental health conditions and cannabis use in the literature. This is particularly heightened when it comes to young people, and the link is strongest with those who have kind of a predisposition or a family history. So again, we still have the questions about whether cannabis use is the cause, or if these symptoms are playing a contributing role in cannabis use. So while the absence of causal evidence doesn't mean that this, won't end up being the case or this isn't the case, it's just, again, further studies are needed to actually clarify these links and really to establish a direct causal relationship or even the direction of this relationship. So I would argue that it's even more complicated when we're talking about mental health because we know that lots of Canadians are also using cannabis to help with various symptoms of an assortment of mental health conditions. And this is something that young people at our roundtable spoke to quite extensively and is often ignored. And once again, it's really important to remain cognizant of the fact that the harms that are associated with cannabis use, although they can be very serious in some cases, are not experienced by a majority of users. What we can't lose sight of the fact that cannabis is not harmless, but it's also not particularly dangerous to a majority of its users. So tightly coupled to this point is that when we're thinking about youth and the potential harms of cannabis use, we also need to talk about various modifiers of harm and kind of integrate this into conversations around cannabis use in young people. So these are adopted from the lower risk cannabis use guidelines from Dr. Fisher at the Centre for Addiction and Mental Health in Ontario. So, we could ask questions about onset of use. So my colleague kind of went into this already, but, there is some evidence to suggest that we should absolutely be working towards delaying the early onset of use, and that links to various indicators of harm are worse with earlier onset. We need to also talk about things like use patterns and frequency. So how often are young people using it? How much are they using? We could also talk about methods of use. So modes of consumption are important here. Are they smoking, are we smoking joints? Are we consuming edibles? Are we vaporizing? Also, product properties are important. So Dr. Kilmer talked a little bit about kind of higher THC products and kind of the vast assortment of cannabis products that are available currently on the illicit or gray market. And as well, thinking about the environment and context of use so that there are more harms associated with different contexts. I mean, the best example is, of course, driving. So really, I wanted to just bring this up to point out that harms and the way that we talk about harms are not really black and white. They're also connected to a handful of potentially modifiable factors, and that these can be really helpful in our discussions with young people. On a larger scale, it's really about how we're going to balance both public safety and individual health, and really how the provinces are going to take this research around youth harms. So the policy answers that are going to be implemented here really need to be situated within our current political and social context. We're really living in a policy environment right now where the alternative for young adults who are 18 to 24 could be that cannabis remains prohibited. And I really question whether or not this is actually the right way to keep young people safer. So how this developing research gets mobilized and implemented and how this plays out needs to consider again that restrictions in and of themselves don't stop young people, young adults or youth, from accessing and using cannabis. And we also have to remember, what's really always strikes me as really interesting is that the war on drugs was also anchored in this discourse around protecting youth, when really it's done anything but. So we really need to kind of shift our public conversations to start focusing more on giving young people the tools to make more informed choices. At our roundtable, the young people that we were working with cited nothing memorable, and in some instances, nothing even cannabis specific about the education they received in schools. They also extensively spoke to how overwhelmed they were when they went online on the internet, the vast amount of resources that are available there, but also from the information they were getting from peers. And the roundtable really highlighted a host of ongoing issues with current drug education. I mean, these are things that have been touched on all throughout the day. First and foremost, highlighting this idea that a lot of programs that are out there right now are mostly rooted in abstinence or stigma-based programming. So it's really coming from a place that prioritizes that young people, first and foremost, shouldn't be using cannabis. So when in our report, we talked a lot about how, education really can't use moralizing or scare tactics. It needed to include honest and science-based information, and it needs to acknowledge that some young people are going to choose to use cannabis, and a discussion of what responsible use looks like and how we can reduce the harms for those young people. A lot of young people also cited the exaggeration of risks, right? So that's probably the biggest thing that we see kind of across the board with current educational programming. This ignores kind of potential benefits or reasons why people use cannabis. This includes medical reasons. It could include simply just pleasure. So what was really interesting was young people at this roundtable were speaking to kind of how they understood sometimes their use as kind of medical or therapeutic as well. And some of them were self-medicating, others had medical documents, and we also know that young people have additional barriers to accessing cannabis for medical purposes legally. And again, so this exaggeration of risk is also important because it doesn't resonate with young people's experiences. So again, this is also probably linked to, something that was said earlier was that, we often are ignoring the spectrum of substance use. So when we're talking to young people about drugs, we're giving them two options. So we're saying abstinence or problematic use, and that as if there's nothing in between. So we have to also acknowledge that a lot of young people use cannabis occasionally or non-problematically, and that deserves acknowledgement. And this is definitely linked to a wider discussion around establishing norms of appropriate use. So we really recommended here that education geared at young people really need to be anchored in youth perceptions and experiences with cannabis and integrate that into their information delivery. Of course, like has been said all throughout the day, the lack of, including kind of harm reduction measures is really problematic. So again, not all young people are abstaining from use. So for those that don't, can we offer them some practical tools to reduce the harms they may experience and tie this back to an understanding of different modifiers of harm? And the last point is I think it links really nicely to the clip we saw before this panel started, was that parents are often being left in the dark here. A lot of people talked about this disjuncture between kind of what they knew about cannabis use and kind of what they were hearing from their parents and what they were hearing from teachers. So, since parents are really kind of key to educating young people and establishing norms around drugs and drug use, they would likely benefit as well from inclusion in that educational piece as well. So I think what kind of was really highlighted in the last presentation was, so young people want to see some new approaches to drug education, that's for sure, but there's really some difficulty in figuring out what actually works. So we have some good data on what doesn't work, but this is really connected to how these kinds of initiatives are best evaluated. So for example, we don't really have a broad set of criteria that identifies what the model or the absolutely best programs are. And of course, this is so connected to the idea that different programs are going to work better in different contexts. And it's really hard to assess the effects of a program over long term. So there's various reasons for that. It's like, following up with people, after the initial survey. And also this really ties back to kind of a more broader need for baseline data and ongoing surveillance and research activities to monitor and evaluate the impact of legislation more generally. So final thoughts. So really, if you take anything away from this presentation, it's just that we really need to broaden our understanding of harms when it comes to youth and young adult use. So our goal should really be to reduce all harms, which needs to include criminalization. We also want to operationalize research findings in a way that reflects both the social and political context that we live in. Public health goals and the decisions that our provinces and our municipalities are going to be making around legalization also needs to think about how these policy options play out on the ground. And we also need to start prioritizing tools and interventions that are going to benefit young people. We need to keep questioning how to truly protect young people and not use evidence or developing evidence in really narrow ways that really ultimately serves to equate protecting youth with more restrictions. So restrictions can play an important role, but they're not the be-all, end-all. Also, kind of the most important thing that I feel like I say over and over again, let's just talk more to our young people. Let's include them in these conversations. Let's not forget that we're basing an entire new framework on this idea of protecting young people, but we're not asking them anything about their cannabis experiences or what they know about cannabis or what they think about cannabis. Our roundtable really demonstrated that kind of given this platform, they offered really insightful experiences. They also make really pragmatic recommendations. A lot of what was said in our roundtable was reflected in the task force report. So they're making really good kind of suggestions that make sense based on their experiences. And finally, in the creation of science-based education, we also need to consider how we're going to measure these outcomes. We need to remain very flexible in how we approach youth and young adults and their understandings of cannabis use. Oh, well, that slide's all mumbled, but there was a lot of references there, I swear. Thank you.